taxes. Joining me now from Capitol Hill in Washington, D.C., representing Georgia's 1st Congressional District, Congressman Buddy Carter. Congressman, the White House is talking tax cuts, and I love it. And I don't care if it's because of Corona. Anytime they talk about reducing the burden on the American people, I'm in favor of it. I assume you are too. But here's a bigger question. Should there be a fiscal response from the federal government right now to something like this? This is a bug, after all. And, you know, like what's happening on Wall Street, we have to also let the coronavirus run its course as well, do we not?
Well, we do, and you make a good point. And then, first of all, I agree with you wholeheartedly. I love tax cuts. I'd like, no matter what the reason, I just like to see them. But the point is here, yes, it is needed. The impact that this is having on our economy is obvious. The impact that it's had on the stock market is unprecedented. And I think what the federal government, what the administration is trying to do is to bring some stability, if you will, to the whole system. And that's what we need to do. We are totally overreacting to this. Now, coming from a healthcare professional, you may say, how can you say that? How can, as a pharmacist, you say that we're overreacting? Well, right now, we're right on the brink of panicking, and we shouldn't be panicking. We should be prepared. We have been prepared. We've done all the right things that we should have done. Now we just have to follow through on it.
And when you compare, you talk about the panic and overreacting. It's something that we've been saying on this program now for weeks, especially when you compare it to the flu. And, you know, we've been through these kinds of crises before as well, whether it's SARS or whatever kind of virus, that eventually human beings develop a natural immunity to. And that's part of the process as well, is it not?
It is part of the process, and that's an excellent point. You know, we've got all of these events being canceled, and I get it, and I understand that people want to be very cautious, and I appreciate that. But at the same time, if we would just use common sense and just use the techniques of washing our hands, of coughing into your elbow, of trying, as the CDC director said, try not to touch your face. I know it's hard, but you try not to do those things. And if you have a cold, don't go to work. If you have a cold, wear a mask. The Surgeon General said that wearing a mask if you don't have the virus is not as helpful as it is if you're wearing a mask when you do have a cold. And as I have been saying since the get-go, because I was a consultant pharmacist in nursing homes, and I've been saying this since the very beginning, that's the most vulnerable population that we have. Stay out of the nursing homes. I know you want to visit your loved ones. Call them on the phone. Let them know you're thinking about them. But for all means, stay out of the nursing homes right now.
Somebody's got to put the coronavirus into those nursing homes. For example, in Washington State, somebody had to bring it in there. It didn't just miraculously generate out of nowhere. That's a great point. Now, the CDC. I'm questioning some of the advice out of the CDC. For example, they're telling people who are over 60 to stock up on supplies. Now, you know, this fuels the fear. It fuels the panic. You know, some of this stuff and the hoarding that we're seeing going on and stripping store shelves of surgical masks and Vienna sausage and what have you. What is important, though, is to remember there's a 5-day, from what we're being told, a 5-day incubation period about this, and that people, you know, with underlying illnesses need to be very, very cautious. They want to stay home, that's fine. But in general, people should go about their lives. Isn't that the message?
That's the message that I would give, and you make a great point. The median age of morbidity for this is 81. The median age for infection is 61. So that's the population that's really at risk here. And yes, you are correct in what you said earlier. We will build a natural immunity to this, but it's way too early to start reacting the way I think that we are reacting. You know, I'm proud of the administration, what they've done.
Yep.
I understand. I was a mayor at one time. I know how important it is to be cautious, and we want everyone to do that. But at the same time, I do have to say that there appears to be just too much overreaction to some of these things.
And I love the idea, on the other hand, that the CDC director was telling Congress just a couple of minutes ago there about these forward positions, these forward bases. It's almost like having U.S. troops deployed in Germany and forward bases, forward installations, so we can fight it over there, Fight the terrorists or the bad guys over there. Fight the viruses over there where they originate. I think it's a wonderful idea as long as the United States doesn't have to pay for it all. Now, CPAC. You did not go to CPAC, but a lot of your colleagues did. And apparently there's a person zero out of CPAC. I'm being told, I do not have this confirmed, that it may even be a doctor. Be that as it may, Congressman Gohmert apparently is not going to self-isolate himself, but Congressman Gosar, your colleague out of Arizona, is. Former Congressman Meadows, now the Chief of Staff of the President of the United States, is in isolation along with Senator Ted Cruz. What are you hearing from these fellows?
Well, I haven't talked to any of them, although they are all my friends, and I know them well. But at the same time, that's a decision that they have to make, whether they're going to self-quarantine or not. And certainly I know that they're doing it out of an abundance of caution, and I can respect that. Again, that's up to the individual. If they feel like they potentially could spread this, then I certainly understand their reasoning behind that.
The bottom line is there's only a limited amount of things the federal government can do to try and mitigate a situation like this. This is a virus. And yeah, we can throw billions and billions of dollars at it. And I hope that money, the $8 billion that's been approved so far, is being put to good use. For example, test kits. Yeah, we probably should make test kits available throughout the country, easily available. And yeah, go ahead and have federal dollars pay for them at this point. But there is a limited scope of what the federal government can do in responding to something like this.
Well, and that's a good point because, no one can do as much as we can personally by washing our hands, by coughing into our elbows, by making sure if we have a cold, staying out of work, by making sure that we're practicing good hygiene. All of that is incumbent upon us as individuals and responsible individuals. Yes, I believe the government has a role in this. There's no question about it. And one of the primary roles of the government should be to make sure that we stay calm.
Yep.
Make sure that we don't panic. Make sure that we're prepared but don't panic.
And I think that's exactly what we're seeing out of the White House. They've got the situation under control. There's a task force being headed by the Vice President. The President is communicating at a fabulous level, almost on a daily basis to the American people, and that's exactly what you should expect out of a commander-in-chief in situations like this. And it's unfortunate that the other side of the aisle is moved on from impeachment to corona as the latest attempt to try and harm and politically wipe out the 45th President of the United States. Congressman Carter, thank you. Coming up next, election.